Should we start the last session?
Yes.
I really don't want to stop you guys talking. I love the collaboration and sort of the networking. It's really, really cool. And I'm so happy that a fair portion of you stayed. Now, this is the last session, not last but not least. I decided to step in to do the last session. No real reason behind it. Technology's let us down again. Rajesh, who's going to be doing the first talk's disappeared off the Teams talk. We literally saw his face, had a chat with him, and he's gone now. I said 30-minute tea break, but it seems to be it's going to take a lot longer. But we've got poster awards to talk about anyway. So we have posters, which if you haven't seen, they are in the other room opposite. There are 3-minute videos as well that have been put online. We've had 4 fantastic panelists help us score them. We've got Daniel at the back who's helped us, who's brought in his ZX Spectrum, Jessica Bailey, one of the local oncologists, and my wife, and also Una Rice, who's one of the ICB people, and digital transformation lead, there we go. And who was the other one? Was it Paul Drake, wasn't it? So he's a CCIO and a colleague of mine in East Grinstead. And so they looked at the videos, watched the videos, marked them, and we can talk about the awards. So in first place is Mary Bonnet. Is she here? Or is she with us virtually? No. Well, let's just give her a round of applause. Hopefully she's watching. And I can see Rajesh is here. Fantastic. So we wanted to make this a very hybrid event. We wanted to allow people to submit posters virtually, be here or not. So there's a few people that submitted them and not here, and that is fine. I think we should try and embrace sort of this virtual lifestyle that we're all trying to meld with face-to-face, which is part of what COVID's got us into. Excuse me, scratchy throat. So that's Mary. So we had 3 prizes. First was Mary, and we have a joint second. One's here in person, I think, yes, and the other one is virtual, I know for sure. So our virtual joint second person is Dylan Go with his poster, so thank you very much to him for winning. I should really be talking about what the posters were called, but I haven't got them in front of me. Sorry, it's been a long few weeks trying to get this all organized. And the person who is joint second, well, I think it's 2 people actually, but the joint person is Nick Lenny. So, well done. You want to come up and get your prize? Yeah, come down. Where's our photographer? So there's even a certificate. Like Helen signed. So and myself. Do you want to do a quick handshake? Very good, well done.
Thank you.
So Mary will be sending her an Amazon voucher, £100, and joint second was 50 each. So Dylan will get one his as well in the post. Now, on top of this, there was a bonus prize. Did anyone get the bonus prize? No one was Rick-rolled. This was Marcus's idea last year. I thought I'd try it out. I don't know if you remember. We had a conversation. Oh, Rick, roll it.
Well, whenever people, if someone says that they're going to put something in a QR code, I'll just give them a Rick roll.
So unfortunately, the person who had it on their name tag didn't actually get Rick rolled, or Rick rolled someone else, shall we say. So there's no bonus prize this year. Next year. We'll keep it until next year. Roll over roll. Yeah, Rick roll. I like it. So, oh yes, I will not forget this. I almost did. I want to get the whole Let's Talk digital faculty down here, please. The ones that are here in person. If you can come down here and join me. Come on, don't be shy. We've got 5 in person, yes, fantastic. I bought 6 bottles, I wasn't sure how many to bring, but I just want to say thank you. Thank you so much for actually helping so much with the actual conference. It's been a great help. And I've got each of you a little present just to say thank you. These guys are amazing. They've helped so much. They've been answering silly WhatsApp group messages at 1 o'clock in the morning. Kevin did that as well last night, by the way, so we had a conversation about that. But I haven't got any wine for you, Kevin, so, you gave us a fantastic presentation. But, yes, these are great people. Talk to them, get involved with them, hire them. Honestly, I would hire them tomorrow if I had the money. I just want to say thank you, so a round of applause again. Right, Rick rolled, bit of wine, roll over. Right, on to, oh yeah, chair to be announced, yeah, well that's been announced. So let's move on to the next talk. So Rajesh, calling Rajesh, are you with us?
I am, yep.
Hi, the floor is yours. I'm just going to mute ourselves so you don't get any feedback. No. Oh, I don't do that. Okay, fine. Off you go, Rajesh, if you want to introduce us. Thank you very much for joining us now today.
Yeah, thanks, Mark, and for the FCI, for the kind invitation. It's really a joy. I apologize that I couldn't be in person, but in the next sort of few minutes or so, I would like to share my thoughts on what our status is as a healthcare providers, that are we ready for a digital healthcare? And I'm thank you for the title as well, Mark, because it is something which I'm passionate about. So I hope you all can see my slides. So I'm a transplant surgeon at Bots Health NHS Trust, and I do other activities. And in addition to that, I'm involved in sort of patient and other stakeholder bodies. And my passion is really to empower patients and healthcare staff to sort of train efficiently and provide sort of care and enhance things what we offer. So there are projects what we do with regards to do that in the recent years. And it's really, I start perceiving these opportunities really to look at a problem when I met one of my patients. So she's called Belinda. She's 38-year-old, high functioning, as you can see, the things what she does. And she's a kidney transplant patient as well. She had kidney transplant. It unfortunately failed, and she's back on dialysis. She always keeps a bag ready for hospital visits. As you know all very well, that these patients' life are controlled by us, not really by them. So she's also a keen photographer. And I was talking to her when her kidney failed, that, hey, what do you feel like? We're giving you all kind of treatment. You are having a very good quality of care. But what do you really feel as a person? And can you express to me in photographs? Because I really wanted to understand where they're coming from. And this is what she sent it to me. So you can see that the patient who are kept alive, well, with high standard of care, feel that they are surrounded by tubes and waters and all kind of things. And that really is one of my drives, to look at the way we offer care, which is not just place-bound, people-bound. And can we look at innovation-based technologies to enhance these opportunities? And this is just for a renal failure patient, which you can apply for any patient, for example. There is a RED as the main hospital where a lot of us specialists are there. The other hospitals are the ones which are closer to the patients. They are back and forth between various things, including doing vital blood tests and appointments and so on. If you just look at what is needed, even to measure their heart rate, they need to go to a hospital. There has to be a nurse. If they need a transport, and you just build them upon it. If they need blood tests, if they need an assessment, if they need further care and further tests and so on, it just means that a patient-centered care is hospital-based, not not patient-centered in the context of what exactly it means. And if you look at where we were, certainly we moved from 1992, where doctors are the directors, nurses follow instructions. We tell patients, this is what you need to do. Now you would agree that there are nurses in management roles to coordinate care for the patients, and we share the patient information and results to the patients after we made a decision. So it just means that still the patient comes to the hospital. The care doesn't start at home. The consultation not even starts at home in majority of the situations. So this really is my driver to look at what are the unmet needs. I'm using a kidney failure disease as a model here, but if you look at it, most of the care what we offer is restrictive. In my world, they can't drink a lot of fluid. We don't measure the quality of life as a prom at the moment. So therefore, there's a lot of things, and it is single point assessment. They need to come in, we do the test, we do the blood pressure, off they go. We don't do continuous variables, which can be done. This just means the patient doesn't feel involved. So that leads to they don't feel they can care themselves. And more importantly, these put together becomes an expensive care delivery model. On top of that, I'm sure you all seen these graphs. Waiting list is going up for what we do. If you look at doctors and nurses, we are getting older. There are more people on the healthcare provider are more than the age of 55. That trend is becoming not just in UK, it's globally. On top of that, if you look at the ratio of number of doctors versus nurses, that's coming closer. That's not ideal. The proportion used to be much better before. It is getting closer and closer as well. So when you ask people with all these pressures, in addition to the other things, what's happening today with our juniors and other colleagues, we all feel that we are just holding our patients above the water. And I think this is a significant issue. And we need to look at solutions, not just by employing more people. We need to look at people, clinical teams, partnering with patients and delivering care, which makes them excited to be part of the healthcare delivery system, what we have. On top of that, can we equip them with tools to make their care delivery easier? So what is the future like? And I'm sure you're all sitting there going, whom should I ask? Whom Rajesh should have asked? I could ask people, but then I thought, why don't I ask ChatGPT what the future of healthcare is? So literally, I asked the question, what's the future of NHS ChatGPT? And this is what it gave me. I did a word cloud with that. So you can see that when you ask about a future, all you see is patient health challenges. Everything else is not there. And then I asked, what is the renal failure care, which can be a respiratory disease or anything? Again, the big word comes out is we need to be thinking about the patient, which we all do, but there are a lot of challenges. And of course, I'm a surgeon, so I thought, what is the dialysis surgical care like? Just to narrow it to sort of what I do. And if you look at this, it is really going towards telemedicine, advanced patient management, looking at remote monitoring, increasing self-care. So it's really looking at moving the patients away from the hospital, but more importantly, offering care away from the hospital. So in my view, the care need to be a predictive, precise, preventative, and personalized care. As much as we can, remote need to be included in that one. And I believe, and there are enough data to say in disease models where it is piloted and trials are being done, it certainly empowers them to self-care. Cost effectiveness, I put the statement there. It is not fully measured in many diseases, but certainly we are pursuing trials to look at this to see how this can look into cost effectiveness of care itself. And you could say that that's all fine. What is the patient's feel about it? And this is a survey done where they showed that the patient healthcare model at the moment is a partnership. It is not delivered anymore. It needs to be a partnership. And if you look at UK in there, a lot of us agree to it, doctors and nurses. And if you look at the same survey where it clearly shows that a lot of the patients are interested in looking at their data. And also, we all feel that the real-time analytics will be critical to patient care. And the survey asked, can the patient influence care? Again, look at UK, bottom down, close to US. We do feel, doctors and nurses in the healthcare system, we do feel that patients can influence healthcare and they are ready to receive these kind of healthcare in a different model than what we do. On top of that, the patient perspective, this was a study done in Queen Mary very recently. And if you look at the trend of it, the older the person, they are more engaged in their healthcare and the tools what they use. So that just means that the perspective of younger the person, they will be involved more. It's actually not true. It certainly seems to be that the older people are getting engaged more. Actually, when you look at the trend of the chronic diseases and diseases in general, the patient age group from 50 onwards, the incidents are increasing. Chronic heart disease, respiratory diseases, renal failure, diabetes, and so on. So therefore, the trend is going towards that way. And I with the team, we developed a sort of a smart patch, which can remotely measure the things what is mentioned here. And this is the first patch which can do blood tests without actually having a needle in. And it can measure blood flow as well. So this we did a study. Now we are doing a validation study on multiple countries. And the whole idea being that this can be done every 6 seconds if I need to, but without any invasive procedures. And when we did the study, we asked the patient, what does that make them feel having this patch? And the patients felt that they are cared, they can sleep knowing that somebody else is looking after them. So that just means that the patients are willing to take responsibility if it's made easy for them. They feel more assured. And of course, in the study when we did, in the UK data, patients are willing to take self-care at home for renal failure, which means they don't need to come to the hospital for their in dialysis care. So that really shows that it certainly is possible that patients are willing to share their care with us. And when we did a sort of cost effectiveness just on the smart patch alone, this is based on the NHS costing on 2021. The gray is the one where without the smart patch. So you can see the significant cost gained across all actions, what is needed to deliver a patient care with a patient with chronic kidney disease. So certainly there is a significant value in gaining cost. At least this is, I would definitely agree if people are thinking, oh, it's a small study population, and I would agree with you, and we are extending the study now. So but at the same time, the initial, what we got, the data when we looked at it was that it certainly adds to cost saving. But then what do we feel? We are feeling, and I think you could see by the way that a lot of us feel that the role of a doctor or a nurse is changing. It's changing on so many directions, some of them by choice, some of them forced by various other reasons. We think the future of the doctor is going to be different, nurse is going to be different. A lot of us feel with what the demand is now with regards to even not including digital healthcare, but other tools, what we need to deliver a hospital-based care, we need IT skills. There's a significant need. It is recognized by the staff, and there has to be frameworks for that. And if you look at the sort of a recent report from NHS looking at how do you develop a digital wealth forward, these are NHS-based healthcare staff said that they are happy to, as long as they are supported, happy to take digital literacy, improve their literacy, as long as it's provided easily for them. They understand that how it can be used in a clinical environment if they are offered. They feel confident. But if you look at the right side of that diagram there, you could see that the last bit is the one where they are not prepared. But most of the people are prepared, but certainly they need to be supported for that. And if you look at how confident people are from learning, when they're in the university, there is a significant interest in people willing to learn these things. So therefore, overall, you could say that there is certainly willingness from all of us involved in healthcare, either delivering it or being in the university, willing to look at these things. Then, of course, when you look at by the profession, you look at this graph, you can see that by the profession, what does people feel about using it on the practical environment? Most of the colleagues sort of in a healthcare team or a multidisciplinary team, we feel that we do feel we are prepared, but certainly there is anxiety. There is no doubt about it, which I'm sure you will agree that it is something we do face when you use a new technology. This is a complicated graph, but that just to show you the thing on the green is that people are aware of the sort of information governance implications. We don't know the nuances of it, but all we know is that we need to be careful. And that's a very reassuring thing that people are not saying, no, I don't want to use it. So that's a very reassuring to look at these people currently in NHS and who are coming to sort of work with us in the future are willing to explore these things as long as they are supported. And this just assures you again that this was a study done by an independent, a GE, really, I can declare that to you. So they looked at how this can be done. And you can look at these things. People do agree that investing technology-based healthcare in NHS will attract younger forces. Now, you know very well this is absolutely what we need. We cannot do the way we are delivering healthcare to a generation of people who are used to sharing information during an app or other tools. So we have to be able to do these things to attract the more future healthcare staff and to potentially retain them. So I hope it shows in the last few slides that the patients certainly need it. Healthcare staff, we feel that this will certainly help. I'm sure you've seen these digital champions which are being promoted recently and more being more organizations are looking into it. And certainly I feel that there has to be more awareness amongst all healthcare staff. People who are invested in it, people who are passionate about it, certainly are aware of it. And I feel that it has to be integrated at the much more earlier level. And that's why I really admire what FCI and other organizations do, because it is not known to many the opportunities, what is available and what is needed. Although many of them feel they would like to have them in their work. Of course, we need to promote visibility of organizations. And when Mark and my colleague Sobat, who introduced me to FCI, I was delighted that I'm able to be part of it. And we have to do more to improve the visibility of these organizations and their work and get support from the stakeholders at the trust level, at the Royal Colleges level, GMC level, and of course from the government as well, because these are the key drivers which are going to make a change in what's going to happen to future healthcare workers in UK. So in my view, the future healthcare staff are going to be more technologically literate. I think it is going to be absolutely needed. They will have clinical knowledge. They will be familiar with data analytics, not necessarily at all sort of expertise. They will be having awareness of like reviewing a paper. They will be able to know some understanding of what these things are. And of course, the other skills which are key to deliver patient care. Governance, I'm going to touch upon it very briefly. There is a lot of awakening has happened at the government level and various bodies. There is a lot of work is being done to look at these things to see how we can partner with industry to facilitate these things. Instead of looking for NIHR grant and driving all these things, there's a lot of trust-based partnership with various independent organizations and industries as well. And if you look at the 2022 the scorecard, which is available in public, the government is really putting together these things because they've realized that they can't just employ another 1,000 people and get them to be as efficient as they can be in a changing healthcare need and a patient portfolio. So therefore, to summarize, I think, and I feel that the digital innovation-based technologies are essential and it's here to stay. Just a matter of how we adopt it. There are certainly, we need to get more research done in this area and more organizations in UK and beyond are involved. And we are fortunate to be driving some of them to understand these tools and develop a very comprehensive framework. But the key here is to equip our healthcare staff with these opportunities, promote organizations, the work done by FCA and other organizations to show them that this can help them to deliver a dynamic, efficient care model. Thereby, they can be part of saving cost in NHS. There is improved funding, but at the same time, certainly I would champion what is being done and to sort of deliver a care which is efficient so that we can deliver a patient care in the coming years where the patient becomes a coordinator, not a care receiver. They become a coordinator, so they activate with problems in a multidisciplinarity, and then they can have an access to their data, so they can be a partner of their care in us delivering it to them. Thank you.
Rajesh, many thanks for your fantastic talk, and thank you for a shout out for the FCI. I've been trying to not wear my FCI chair hat today and be more of a co-host for the conference. Anyway, I'll leave it at that. I'll put my other hat back on. Can you stay on for Q's and A's after we've had a few more talks? Fantastic. All right. So next up, let's do a quick close change / camera change. Fantastic. Now, come on. No? Oh, it's
that's my last
keynote,
slide.
so you have to do Done. Right, next we've got Andrea Preston, who's come to talk to us about her CML work. She gave us a fantastic talk about it last year, but has some extra information to give us. She is the Macmillan Division lead pharmacist.
No, not anymore.
Not anymore.
Actually,
okay, so this is old. All right, but
have we got another slide? Sorry, it's the wrong.
Is there?
Yeah, sorry, there was another deck I sent.
Was there another deck?
Sorry, yeah.
Okay, well, things are mixed up. So I'll let you introduce yourself. So you've changed completely from last year. Okay, that's good to know.
Yeah.
All right, very good. I'll leave it at that and embarrassingly walk off.
Do you have the other deck?
The other deck?
Sorry, that I sent.
Okay.
Sorry, Mark.
No.
I emailed it.
No, I don't.
Okay.
Would this be all right, this one?
Yeah, sure, it's fine. Sorry.
All right. Right, play. Fantastic.
Brilliant.
Thank you.
Thank you. It's really lovely to meet you all. I'm sorry I haven't been here throughout the day, but I hope this complements the last talk about empowering patients and really getting them involved in their care. So sorry to interrupt Mark there, but I have had a change in role since last time I spoke. I'm a haematology pharmacist by background, was in the NHS for over 20 years. But recently I've taken up an opportunity with Sanias Health, which is a health tech company, building on from the work I've been doing on the CML app. But I also continue as a haematology pharmacist for myeloma, doing a clinic once a week in Bristol. So thanks, Mark. Sorry for that. So the objectives for today, I just wanted to describe the background and the sort of key features of the My CML app, but really go on to talk about the post-launch qualitative analysis we've done and what our future plans are building on that in the sort of digital innovation space. So My CML was co-created by myself and a haematology pharmacist in Birmingham called Nick Duncan, but also created very closely with patients living with CML. It took 6 years from concept to launch, but we launched last year in February. And the initial idea really was to support treatment adherence. As pharmacists, we're really passionate about medicines optimization and really wanted to try and encourage patients to see if tracking their response, their symptoms and all their well-being could help with adherence. And CML is quite a rare disease in the fact that we actually know from good sort of trial data that it definitely has that good compliance is definitely linked to better patient outcomes. And what we also wanted to do was capture that information in between clinic visits, because CML is a chronic condition, so patients are seen once every 3 months. And they'd come to clinic and say they've been feeling really well, but then the partner will chip in and say, actually about a month ago you were not well, you had X, Y and Z, you were really irritable and worse often. So it's about capturing that really true holistic patient so that we as clinicians can make better decisions about their management. And so we created it by doing an online questionnaire, which was publicised by CML Support and the UK CML Facebook group, which I think is really important in getting that patient engagement from the start. And that then directly informed the design and functionality. And I just want to emphasise about why it's so important for CML, because I obviously want to do this for other blood cancers, and that's what I'm passionate about doing going forward. But we started with CML because we know that if patients take their medication more than 90% of the time, they can have a similar life expectancy to the general population. And there was a really good study by David Marin at Imperial where they showed that patients with good adherence, defined as more than 90%, their probability of achieving a major molecular remission was more than 90%. And if they didn't and they had poor adherence, it was just shy of 30%. So that's incredible data to support how important it is. But I don't think we always, convey that to patients. And that is just missing 3 doses a month. And what we find in CML is that patients will kind of fess up now and again that due to kind of low-grade grumbling side effects, they actually stop taking their treatment. So if they've got a party, they'll stop it a couple of days before and then restart after, or a holiday. They may even take 1 or 2 weeks off treatment, which can really mean they're not getting the best response that they possibly can. We designed the app by going out as a study, and really embarrassingly, Nick and I actually didn't think of a drug interaction checker as pharmacists, but that was the top request. But we focused on the top 5 and built the app around that. So this is the finished product. And I'm just going to whip through a bit of the menu and the key features. So the My Progress section, that generates graphs for patients, and they can share them. They can export it via a CSV file to share with their clinicians. This is all patient-entered data, though. And so they've got their BCR-ABL graphs, they've got their lab results, their adherence, which is the important bit. I wanted them to visually see whether they were hitting above that 90%. And then there's symptom tracking. So we've pre-populated it for CML as a condition, and also for the tyrosine kinase inhibitor side effect profile, but they can also add their own as well. So this will mean we can adapt and modify this to other hematological or other diseases, which we're really keen to do. And I want to make it bespoke for each patient population, because that is how you get them to kind of keep using it. The medication tracker is a reminder feature, which they say whether they've taken it or not, and the rest are sort of self-explanatory there. And what we found, so after launching, we did some sort of top-level Google Analytics, because with the app at the moment, it's just patient-held information. But what we realised, we've actually had a global reach, and we've now actually, since I did the slides, 92 countries we've now been downloaded in, with over 1,400 downloads. So we're obviously, as pharmacists, delighted with that. And when we did a survey, 44 patients we surveyed, 85% were still using the app. And 52% were using it every day. And the main reason for not using it, some of them just felt they were quite stable and didn't need it at the moment. Others found they had a better medication reminder on a different sort of non-CML app. So we have taken on board feedback on that, and that's something we're working on in the next phase. Patients wanted more visual features, more kind of videos really of how to use the app, rather than it being all text. And we're translating into the top 5 languages in the UK, plus Welsh, because you wouldn't believe Welsh isn't actually in the top 5. So we've got 6 languages we're going to be translating into. But what was also really important, we had lots of other feedback as well, which I've listed on the right there. Sleep quality, patients were keen to look at that, physical activity, behavioural risks, social support, really holistic things that we can do quite simply with an app and really empower patients. I was very lucky. I'm on the NHS England Clinical Entrepreneur Programme, and I was very fortunate to meet Landau, who is the founder and CEO of Sanius Health. And what I really wanted to do is, obviously, as I've said, this information is all held on the patient's app. But this is really rich data, which can really help us, help patients and drive research, and really get those questions that we want to, to answer. We also reached out to patients when we were doing the post-launch survey and asked them how they felt if their data was to be used for future research, and if we could access that data. And it was really surprising that all of them were really keen, and all really emphasised about how they want to help future generations of patients who have CML. And the clinician community is obviously very interested. There's a lot of quality of life data that we're not capturing. I was at EHA last week, and some of the myeloma trials, there's the patient advocate from Myeloma Europe was showing how it is increasing over the years that we're getting quality of life data reported in trials, but it was just over 25%, which is, really shocking. And also, we're also, getting these patients to fill in a lot of questions, and they're not feeding back to them. They're not really seeing how they compare to other patients. So Sanius Health, they are a patient-generated data platform, which has a digital patient wallet, and it really allows patients to have a greater, deeper insight into their own health. They issue an FDA-approved wearable device so that it can then integrate with, the sleep quality, physical activity, heart rate, hydration they're looking at the moment. And the most experience they've got at the moment is in the sickle cell disease area. And what they're doing there is trying to help encourage patients to see what things trigger a VOC for patients. So what set of parameters would do that. And what they have then do through sort of machine learning is looking at predictors. So patients get a text if they're meeting, some of the criteria that would show they might be at risk, and then they're just told to, you know, just maybe take some extra care over the next couple of days. And they've had this phenomenal impact where they've actually shown that they've reduced admissions to hospital for VOC, and patients are much more able to manage their crises. There's a lot around pain management, pain reporting, fatigue, etc. So what started out when Sanias first came was really driven by just about capturing patient data in between visits, which was clinician-led initially. But what that's turned into is, you know, having an impact on flow, having real, you know, they're showing real benefit on patients' quality of life because they're just feeling more supported. So as I said, it allows them to track and monitor their condition, and these are some screenshots from the Sanias wallet. In the interest of time, I can't really go into a lot of detail around it today. But what also they encourage to ensure patients are inputting their data and adhering, because the sickle cell community can be quite difficult to engage with as well. So what they do is when patients enter their quality of life data, so they currently use the EQ 5D5L, but we'll adapt that for each heme malignancy, generally using the EORTC quality of life tools. But what they do is encourage that points are given when you fill in your report, and then points aggregate and get turned into vouchers. So for the sickle community, they never obviously give cash, but for the sickle community, they found that they hate getting admitted to hospital, hate the hospital food, and can sometimes have issues with travel. So they issue vouchers for Uber or Deliveroo, which is really listening to that patient cohort. And this is what we'd be keen to do with the CML patients. So we had a patient webinar a couple of weeks ago with the CML patients, and we had 100 register. I think 62 turned up, but they were all really positive as well about the future of what we're doing with the app and how we can take it forward. The extra benefit, because we're all talking about how we need to empower patients and give them digital tools, etc. But a lot of the patients in the cohorts I'm looking at, they are at the elder end of the range. And I know you'll see old people sitting and scrolling on Insta rather than having chats when they're having dinner now. But some people do need a little bit more of support. And what Sanias also offer is coaching support to try and help patients. So they reach out to them from a tech perspective just to check they're getting on okay. But what they found is that they're actually, another pair of ears to, help signpost them to services, give them the reassurance to, go for clinical care. They're not clinically trained, but they will, obviously alert them if, say, they've picked something up on their wearable or they're suffering with certain symptoms. They'll reassure them to contact their clinician, because, we all know we're under such capacity and such pressure in the hospitals that the patients feel that and don't want to reach out to the CNS sometimes. They feel like they're, completely inundated. So this, coaching system and extra support, I think, is going to be phenomenal for our CML patient cohort. So it's a bit of a whip through of what we're doing. I hope that was helpful, Mark.
We'll do Q&As at the end.
Okay,
so
brilliant.
If you just want to sit yourself down. Thank you very much for that. And sorry for getting your titles wrong. No, it's fine. I was going to get onto your new job as well, but I didn't realise you left the old job, so sorry about that. And I realised, I was working on the conference till 1 a.m. last night, so I'm now feeling the effects of that. I did forget to do a shout out to Dylan and Sobafu as well, who are not here today, but have really helped tremendously with everything to do with the conference, posters and websites and so on. So hopefully they'll see this recorded or watching it right now. Right, so the next talk was going to be from two colleagues, but unfortunately they can't be here today. So they're giving us a video, and I think Joe McDonald's also made a video as well, so we'll try and link that up to the YouTube channel for Let's Do Digital that people can look at later. So Majid Kazmi, Director of Innovation for Cancer and Surgery, Deputy Medical Director for Guy's and St Thomas's NHS Foundation Trust, and Paul Landau, the CEO of Careology, have made a video for us, and I think they've got another colleague as well involved. So let's see if the technology is going to work for us on that one. Good.
Good afternoon, everyone, and thank you for joining us today. I am Cassie and I'm excited to introduce to you Paul Landau from Careology, founder and CEO, and Dr. Majid Kazmi from the NHS Guy's and St Thomas's. I will let them both introduce themselves in a minute, but just to talk about digital cancer care and empowering patients beyond the hospital walls is the topic for today, and we'll get into some questions in a bit.
Thanks, Cassie. Really lovely to be here this afternoon, and apologies that we couldn't be with you all in person. We just couldn't make schedules work. However, delighted to be here. My name is Paul Landau. I'm the CEO and founder of Careology. Careology is a business which I founded about 4 years ago now. I've worked in the health tech space for about 20 years, but it really was the experience of supporting my wife through a cancer diagnosis and really understanding firsthand the challenges that patients themselves, but also caregivers and the clinical team really face in such a complex pathway. I'm really excited to be telling you a little bit more about that today.
Hi, thanks Paul, thanks Cassie. Good afternoon everyone, and again, like Paul says, sorry we can't be there in person for what would have been a really interesting event. I'm a practicing hematologist, which means I look after blood cancers. I've been practicing for over 20 years at consultant level at Guy's and St Thomas's. But I've got a particular interest in innovation. I introduced the first cancer information solution at Guy's and St Thomas's. I then helped lead the project for the new cancer centre, which was an innovative and patient-led design. And more recently, I've taken on the role of Director for Research and Innovation at the Trust for Cancer and Surgery. Great to have this opportunity to tell you a little bit about what we're doing with Careology.
Great, thanks Paul, thanks Madge. Okay, so let's get into some questions. Paul, in a couple of minutes, could you please explain what is Careology all about and what are the capabilities, please?
Yeah, absolutely. So Careology is a platform, as I mentioned in my introduction, was designed very much with the challenges in mind to how we better support all the key players in a cancer pathway. And very much front of mind to me was, how do we build something which can better support and better equip patients, helping that person feel far more confident as they're going through their treatment and safe as they're going through their treatment, whilst also making sure that friends and family acting as informal caregivers could have a better understanding and also better equipped to support their loved one with confidence. But critically, one of the things that really struck me as we started researching the space was how clinical teams are always having to really work reactively. And a key insight for me was, when that patient is at home, in between treatment cycles, they're really having to make quite clinical judgment calls and make decisions as to when they pick up the phone and let the clinical team know about an issue that they might be facing. So what we've built at Careology is a technology platform, a digital platform, which is made up of two main components. You've got an app or web access for patients and their family members when they're at home, which really allows that person to do a number of things, ranging from tracking their toxicities, their side effects from treatment, helping them understand when they should be letting somebody know about something they're not tolerating well, but through to other really important capabilities like effectively managing their medications day to day, which we know can often be really daunting and really complex for people to get right, enabling them to keep their treatment journal, managing appointments, but then through to kind of softer, more holistic kind of supportive care elements, so accessing things like recipes, articles, tips, content which is personalised to them based on their needs. But then the other key element to the platform is Careology Professional, which is the interface that is used by clinical teams, that, going back to the title of today's talk, is all around enabling clinical teams to extend their reach beyond the four walls of the hospital and really giving the whole clinical team an understanding of how their patients are when they are at home and outside of a clinical environment. So one of the things that really struck me, again, when we were ideating the platform, was cancer is almost the inverse of most other healthcare conditions, that you go to hospital when you're well for treatment, and then you come home where often you're really quite unwell and coping with the side effects of that treatment. So really what Careology is doing is connecting all of the main parties involved in that pathway and allowing clinicians to have that visibility and oversight as to how their patients are wherever they may be. So patients are better equipped, are given permission, if you like, to make better decisions for themselves and manage those day-to-day elements of their care, while simultaneously allowing clinical teams to work more proactively if something needs attention, but also when it just comes to regular appointments or consultations. Now the clinical team, so Majid's team at Guy's and St Thomas's, for example, can actually pull up that patient's dashboard and really see how they've been tolerating their treatment since they were last in, any issues they may have faced, and use that data to be more proactive and understand any tweaks to that person's course of treatment or any other supportive medications they might need, or again what their holistic needs might be. So it's a really rich feature set that has been designed to better support all of the main players in a cancer pathway.
Thanks, Paul. That's a great introduction about Careology, and excited to hear more. Madge, what were your first impressions of Careology and why did you partner with them in the first place?
Thanks, Cassie. So for us, the recognition of the need for a platform that can better support patients and better support staff has been a combination of a series of events over the last 10 to 15 years. So we set ourselves an ambition to be a globally recognised cancer centre with excellence in cancer care. And part of that work was building a cancer centre. And as we went in that project, we did a lot of co-design and co-production with patients. And what we realised was there are a lot of things in our systems, the way we operate, that aren't really geared around the needs of patients or their carers. And so examples of that would be unnecessary visits to the hospital, feeling sometimes that the consultation isn't focused enough around the needs of the patient. Feeling, and we got good evidence from the last 10 years of National Cancer Patient Experience Survey data, that patients were not feeling that they were getting the right level of information about their diagnosis and their treatment. So there's clearly a need to do things differently from what we were doing before. And we were putting out the feelers to a variety of companies in this space who were coming along with tools that could help support patients in a variety of different ways. But the thing that struck me with Careology was, out of all the companies we spoke to, they seemed to really strip it back to the requirements of the patient. It was really quite clear to me that the whole team and the whole ethos behind Careology was really around how patients can better be supported through their journey from diagnosis onwards. But also there was a keen recognition around freeing up staff. So staff time that could be better deployed to look after those patients who really need it, and give other avenues, other routes for advice, support and guidance for patients where that may be more appropriate, for example, primary care or pharmacy. So it was that kind of, I suppose, common purpose where we felt very much aligned with Careology in what we were hoping to achieve and what they were hoping to do. And that's really what struck the chord and made us then formalise that relationship.
That's fantastic. And a question to you both now. What are the most exciting parts about this tie-up and this partnership? Paul, let's go to you first.
Yeah, thanks, Cassie. I think from our perspective, Madge has touched on some of these points, but I think that over the last 3 years or so, we built a really feature-rich capability within the Careology platform, supporting the key stakeholders that I've talked about. But what is so exciting now, working with Madge and the team at Guy's and St Thomas's, is we're now able to really understand the needs of a very large, sophisticated cancer centre, and work really collaboratively and closely with Guy's to understand, based on what we've got today, anything that needs kind of fine-tuning or iterating to really make it fire on all cylinders and support all the stakeholders that we talked about. But then bigger picture, looking at what entirely new capabilities that perhaps we haven't even thought about yet, but from a cancer centre with the sophistication and the skill set that Guy's Cancer has, really then be able to work closely with them to spec out this is a gap in capability or a new opportunity. What does that need to look like? What does it need to do? And what's the right clinical rigour that then needs to be built into the platform to really deliver that? So it's becoming a really close collaboration where the Guy's and St Thomas's team are almost becoming an extension of the Careology team, and we're able to ideate and collaborate together to keep evolving a world-class digital cancer care solution.
Yeah, so from my end, I'd echo a lot of that. So for us, the real exciting piece of this is embedding the current capability of the tool. We've got some really good feedback already from our patients and staff who are using the tool. And, as we've learned over the last year or so, as we've deployed it, and we're rolling it out across a variety of tumour groups now, there are learnings. But once you work through those, actually the value starts to come, and we're starting to see that now. But the real exciting piece for me is where we take this to. So I see a joint ambition really to make this a almost like a key tool or key application for anybody going through a cancer diagnosis and treatment and beyond. So hopefully this will be your concierge, your support, your kind of carer in technology, whatever you want to call it, but that help that's there with you 24/7 when you need it, and the capability to do more than just give advice and guidance, but actually to collect data, which will then allow us to be actually even more targeted going forwards in the interventions that we do. So we know right now that a lot of things we do is just blanket across a whole tumour group, and that means that some people are getting more than they need and other people are not getting enough. And with this kind of tool and with the data that comes through, we can be much more nuanced about how we support different needs, different individuals. And then as we talk about, and we know this data that's coming through around equality and diversity and inclusion, there's always a risk with digital inclusion, but we've been very much focused on not allowing that to happen. But the real upside of this is that you can start to support those groups that historically may have struggled to get support because of their either got a disability, a language barrier, socioeconomic reasons, whatever they may be. But we build all of that into a tool, and that really then genuinely can bring equity of access to all patients in not just in Guy's and St Thomas's, but across the systems, both nationally and internationally.
Really game-changing work, so thank you for explaining that. I think it really helps people to understand exactly what it feels like in people's day-to-day lives as they go through cancer, so thank you. I think, Paul, let's quickly touch upon what else Careology is working on, and are there any other alliances that you guys are working with?
So the product roadmap is very broad, and I've touched on that already, I think, in that previous answer, and working with Guy's and other partners to understand what are the needs of the market and how we continue to evolve the product. But we're certainly looking at some very exciting new initiatives and new capabilities. As Maj says, a lot of that is based on data and what we can do with that data to improve clinical workflows, improve clinical safety, and really build capacity in the system whilst improving patient experience. So lots of different areas. And I think in terms of some of the other places where Careology is now being deployed, and another key relationship with us is with East of England Cancer Alliance, where we recently went live with the James Paget NHS Foundation Trust, with a big focus there on prehab. So that's an exciting area to be working on, how we can better support patients who are preparing to start treatment, and also doing some really interesting work at the Royal Marsden with the TYA population, again looking at holistically how we can better support teenagers and young adults going through a daunting diagnosis, to support them through treatment, but especially with an emphasis on mental health support and addressing a lot of the issues which clearly for a young person going through cancer are going to be facing and worries that they have. So lots of different settings and lots of different opportunities. So it's a really exciting time for the adoption of digital within healthcare and cancer care specifically.
That's great. Thanks, Paul. Thank you to both of you, and we really look forward to seeing what else is there to come.
It's a pleasure. Thanks for today. Thanks for having us.
Thank you.
And if you're watching, thank you very much, Paul, and thank you very much, Majid, for that video. Sorry you couldn't be here. We might leave you some comments from the YouTube channel, but I'd like to go into the Q&A. So, of course, we've only got 2 people, one virtually and one in person. So, Andrew, if you would like to come and stand here. And we've got Rajesh, larger than life up there. Right, can I open it to the floor first? Have we got, straight away we've got a question. So, Rajesh, can you hear?
Yeah, I can.
Yeah, fantastic. So let's see what the question is.
Well, so as patient advocate, I'm very interested in patient-facing apps, and during my treatment, which was 8 years ago, I didn't have the benefit of those. They weren't around, and I did it all on Microsoft OneNote, and I would take that in and give my information to the consultant each cycle. But running a very large group of support group for over 4,000 people, we're always telling people, if there's an app available, use it. Otherwise, do a paper chemotherapy journal or something like that. And if people, a couple of years now, somebody wanted to give us some money, I said we could use that to make an app. But then I saw people coming along with apps, which is great. And I'm really aware of the importance of the data to be part of research, and the whole idea of having a virtual arm of a trial, which can be done from large things. But from a patient point of view, who owns the data? So presumably with Sanius, you own the data, you sell that, that's the business model. Presumably you don't charge the patient anything.
No, everything is free for the patients, including the wearable devices.
And you make money from selling the
the patients consent into the ecosystem and to the wallet, and they consent at that point for us to use that data in an anonymised format for research purposes, where we work with clinicians to identify. So we're already working with, for example, for myeloma, I'm very heavily involved in the UK Myeloma Research Alliance. So we're currently planning, what are the gaps in real world evidence. For sickle cell, they work closely with the Sickle Cell Disease charity. So at any point as well, patients can, if they want to withdraw that consent, the data gets absolutely completely getting rid of.
I understand that completely. And the importance of real-world evidence, I've got a paper coming out on that soon, which is really important. But I do like companies to be transparent about this. There was a case not long ago of a company doing an app like this, and they supplied for a pharmaceutical company information on the data for 30 patients. And they charged the pharmaceutical company 23 million. So that works out the best part of 700 and something thousand per patient. That's very profitable for the company. But I sort of feel that the patients were ripped off a bit there, quite significantly. And I also wonder what the cost would be if it wasn't a pharmaceutical company, but academic researcher being funded by Cancer Research UK, which we will put our money into. So there's a real concern there about, from a patient perspective, of who owns this data, where's the benefit of the money going to, because if it's just being creamed off for a handful of people to make a huge amount of money based on that data, then it doesn't feel very equal. And it doesn't, and I can see, the people are giving it in good faith because they want to see things which will cure diseases like cancer.
Absolutely.
And so I'm really concerned about that dividing line.
Yeah, just to sort of say from a research perspective, so what we're looking at for, I'm not sure how much is confidential. We're working very closely with guys actually for MPN and working with MPN Voice at the moment to structure that. So Sanias is investing in that in partnership with MPN Voice. MPN Voice are looking at the funding model, but we're working in partnership with them to take that forward. I'm sorry, I've only recently joined the company, so I'm not familiar with all the you know, those historical cases you're talking about, but I know Sanias do invest a lot. There's a whole story around where the inception of Sanias came from, with actually a patient themselves just wanted to get that longitudinal data approach and really patient-centric benefiting patients. I'm not sure for Careology I don't know if they're here, Mark, to sort of talk about. No. But we're working very closely with NHS trusts and with...
I'm just because I see it's a burgeoning field now.
And if I can add to what was said, actually, it is a very important question, because I think it's essential that we show that it's transparent, the process of it. And for instance, one of my clinical trials, digital trials, the patient is in the application form for the MHR application. So I think you can definitely include patients on the research side of things. And I think a lot of the companies have recognized the need for it. So if you look at the patient board structures on these companies, I think they are recognizing the value of it. And I think maintaining transparency as much as they need to be. I think otherwise this will actually affect us engaging patients more and more. And I think the question asked was absolutely valid. And also from the wider sort of regulations point of view, there are more coming into this being more regulated, like any other research in our work. So certainly, it is something we need to continue to engage and maintain transparency and keep our patients in all stages of these things. Yeah.
Fantastic.
Totally agree.
Thank you, Rajesh. Is there any other questions in the room for either Rajesh or Andrea? No. If I may, because we're running a bit late, I'd like to draw this to a close. If I can just get everyone to do a round of applause. Thank you, Andrea, Rajesh. Thank you so much.
Thank you very much.
Thank you.
Right, so quick computer change again. Oh. Right. Second last slide. Thank you very much again to our sponsors, SWAG, the Southwest Cancer Alliance Group, the FCI, MD Cole, and the University of Gloucestershire, who helped in many different ways to make sure this conference actually happened the next tier up from the level that we had last year. It worked last year, but we just wanted to make it a bit more professional, a bit more involved, get some nice lanyards and all the name badges and stuff like that. And I think we pulled it off. It was kind of seamless, wasn't it? And I very much want to thank the Unit 1 Films who've actually helped with the AV side of things. A great shout out to them. So thank you everyone for coming. Thank you everyone for watching online. For those that have watched us, for those that have come here in person, make sure you sign the register. We will send you a survey. I know everyone will get surveys, but in exchange you get 6 CPD points. So you can help with your appraisal. Woohoo! So yes, thank you everyone, and I'd like to draw today's for a close.